I'm Hunter Kelly. This is Up to Date. Good evening. This show is affiliated with the Center County Report, but it is solely produced by me, with stories from other student journalists to bring you the news you need to know as the coronavirus pandemic surges on in our country and around the world. These newscasts will be based in fact, reporting on what is happening in the world to date. We're not here to frighten you, we're here to give you the facts. Fact, there have been 468,000 cases of the coronavirus in the U.S. and over 17,000 lives lost. And by the time this airs, there will undoubtedly be more. But there's some more encouraging news. The White House's updated coronavirus models show a reduced prediction of deaths by August from 80,000 deaths to 60,000, showing somewhat of a plateau in the curve. However, top health officials are still heavily advising that this is not the end. Instead, it is just the beginning. They say people must remain socially distanced from others. We have important information for you, so stick around. Thanks for joining us. Let's get after it. Top health officials say they are expecting the apex of the coronavirus to occur 2 days from now on Easter Sunday. The apex is where health experts predict we will see the most amount of deaths and new cases. The silver lining is this: the country is beginning to see an increase in the amount of COVID patients recovering, that total reaching 25,928 and slowly climbing. And as we said before, the White House now projecting less death tolls than was previously projected, now predicting roughly 60,000 deaths by August. Students will not return to the classroom in PA. On Thursday, Pennsylvania Governor Tom Wolf canceled school for the remainder of the academic year for K-12 schools. There will be no physical school sessions for over 1.7 million students in public and private schools across the state. Governor Wolf said, though, that the closure doesn't mean learning is stopped in PA. Students will continue their schoolwork through online websites such as Canvas and Zoom. And in Los Angeles, California, Governor Gavin Newsom announced on Monday the opening of a new surge hospital. The temporary hospital will provide additional beds and ICU capacity for the COVID-19 pandemic. The surge hospital is a collaboration between the state of California and Los Angeles County Health Services. The facility is expected to open April 13th and could eventually have a capacity of 266 beds. This comes just as the country is expecting a surge in new cases. The new surge hospital will not accept walk-in patients or have an emergency room. On Tuesday, the Inspector General who was overseeing the $2 trillion coronavirus stimulus bill was removed from his position. In places like New York City, medical personnel helping coronavirus patients are stretched thin and fed up.
We need supplies. We need more than one gown per shift. We need to not be transmitting coronavirus from patient to patient and home to our families.
An Inspector General report based on interviews with over 300 hospital administrators in late March showed that there were dire and widespread shortages of key medical supplies, as well as continuing delays in testing. This coming almost a month after Trump said this.
I think importantly, anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the test.
On Monday, the president was asked about the report, but he dismissed it as being political.
It's just wrong. Or longer. Did I hear the word Inspector General? Really? It's wrong. And they'll talk to you about it. It's wrong. Give me the name of the Inspector General. Could politics be entered into that?
And on Tuesday, Trump removed Glenn Fine from his duty as watchdog for the $2 trillion stimulus bill. This coming after Trump fired Intelligence Inspector General Michael Atkinson last week, who reported a whistleblower's complaint to Congress, which sparked the impeachment trial. Democratic Congress members such as Chuck Schumer and Nancy Pelosi said they believed Trump's removal of watchdog Glenn Fine was politically motivated.
He is now being removed by the president sending in some of his loyalists. So this is really a problem.
Coming up, I talked to a local Pennsylvania doctor about the drastic increase in cases this week. Stay with us. There are more confirmed cases of the coronavirus this week than there has been any other weeks of the virus. Here to explain, I brought in Dr. Rob Danoff, Physician and Program Director at Jefferson Health in Bucks County, PA. Dr. Danoff, thank you for joining me tonight. I wanted to get started here. We're in the middle of the week, as I said. That's been kind of the worst week so far with the virus. How much of this rapid increase has been due to the fact that there's been more widely spread tests available, and how much of it is due to kind of more rapid spread of the virus?
Well, Hunter, you raise a great point. So with this type of virus, it actually can spread very easily. So for every one person that has it, they can spread it to 2 or 4 other people. So it spreads easily. Most people do well. It goes through the neighborhood, and it can spread by someone coughing or even talking if you're close to there, and the particles can linger in the air. And if you inhale that or breathe that in or touch your eyes, your nose, your mouth. So 2 things, it spreads easily. And the other thing is we're increasing our testing. So it's not unexpected to be able to count that there are more cases because we're testing more. If we didn't test more, we'd say, gosh, there seems to be a lot of people with cold-like illnesses. What's going on? So they're kind of intertwined. Now, the good news is it seems like this is peaking in certain areas of our country, the East Coast by New York, New Jersey area, and also the West Coast. And so hopefully it's reaching a peak, and then stopping the spread will be decreasing because of all the preventive measures that we're taking.
And now, as places are starting to see more of an impact of social distancing, the president has been repeating the fact that he wants to see the country start getting back up and going again eventually. My question to you is, how long do you see this going on for, and how fast do you think the country could actually get back to work?
We have a big country, and so what's happening is the coronavirus 2019 is going in waves, and it seems like it's bi-coastal, so it kind of hit the Northeast New York area and also the California coast, and now it's starting to go inward. It's in the South. It'll start to go towards the Midwest. Now, the advantage that a lot of other places have is that they've seen the trends and what's happening. So they've been practicing social distancing, which is very, very important. And also what's added important is I'm glad the CDC has recommended that people wear masks. Because if you look at countries where they have done very well against this, they're doing everything that we're doing, but they added the mask. And the saying goes, my mask protects you, your mask protects me. So we need to add that other layer. Now, as far as where it's going inward. There's other areas of the country that are going to have these cases. For instance, Ohio is doing a great job. They social distance early. They stop some big events in anticipation of doing this to decrease the spread. So what we're hoping is that there won't be as high amount of cases other areas of the country because they've learned what to do in the areas that have been impacted the most. Now, that being said, we do know that areas where there's dense housing, where there's a lot of people, say in apartments, a lot of family in a small apartment or in condos, those areas tend to be the ones that maybe it can spread more rapidly. And it's harder to social distance there, but it's just as important. So if we're all doing our part, if the virus has no one to infect, it will stop.
And when we start getting on the downslope of this curve, what are ways that we'll begin to start kind of phasing out social distancing?
So they're going to start in really small amounts. They might say, okay, we're opening up some more stores, but what we want to do is, again, limit the amount of people in the store. Maybe if you're at a restaurant, you're sitting, at least 1 or 2 tables away from each other. You're going to be wearing a mask when you go in or some type of cover. Of course, take it off when you're eating. They may open up other type of stores too. But again, it may not be the same. So when you go in there, they may limit the amount of people in at one time. When we're on public transportation, they may limit the amount of people in a bus or in a train, just to keep the distance until we get a better handle. Now, there's something called community immunity. And what does that mean? Well, because this is so mild in so many people, we think that more people have actually had this and they're developing antibodies to it. And the more people that have that protection, the safer it is. So we have to keep track of it by, testing. There's a blood test that's out now, and this is very important. It can either be by a finger stick or it can be drawing the blood. But basically, it's almost like checking for hepatitis or mono. We can tell if someone has had this, and if they have an immune response to it. And I think that will be very helpful and something that we're going to be doing in the future. So a quick sum up of your question, it's going to be region by region. It's going to be when they have detected a decreased amount of cases, decreased amount of people going into the hospital, decreased amount of people in the intensive care units. When they see that trend, and it's a firm trend for 3, 4, 5 weeks, then they may start to open it up on a limited geographic area and then spread it from there.
And you've been on the front lines at some of these testing sites where you've seen people affected by this virus. What has the experience been for you, and how are people dealing with this?
You know, no one's ever going to look at a cough or a cold ever again the same way. So people are scared. They come in and they say, oh my gosh, do I have this? And then they'll say, wait a minute, I get this every spring at this time. I said, yeah, do you have like spring allergies? Look at all the pollen. So people are scared, they're worried, and this is the first thing that goes to their mind, whether it's stomach issues or breathing issues or a fever. So here's the biggest thing. If people don't know what they can do to help take control or do something, they feel lost and they feel depressed. But if you give them something to do where they can take an active part in their health and preventing some illness, they feel better. So we'll talk to them and say, okay, here's what you can do. Number one, most people do fine. Number two, social distancing works. Look at what other countries and other areas of our country are doing. Number three, you go home and you isolate while you have these symptoms. Most people do better at home. And number four, we're asking them again, hand washing, proper hygiene, wear a mask if you go outside, protect other people, and they'll protect you by wearing a mask. But social isolation, I'll say to them, you know, everyone has a job to do. So whether you're front lines working in the supermarket or first responder, or if you're someone that your job is to stay home, that's your job. And your job is just as important as our jobs. So if we all do this together, then we're going to do better as a whole community and as a nation.
Certainly. And Dr. Rob, thank you so much for joining us tonight. Thank you for your insight, and thank you for all the work that you're doing to help people out there.
Thanks, Hunter, for getting the word out. Appreciate it.
As the coronavirus pandemic continues, we've all continued to receive differing messages from the top officials in our country. Just a few weeks ago, the Surgeon General said he didn't think Americans needed to wear masks.
What the World Health Organization and the CDC have reaffirmed in the last few days is that they do not recommend the general public wear masks.
Shortly after that, the CDC put out the directive that they were encouraging that all people should be wearing masks in public places. Then Dr. Anthony Fauci, infectious disease expert on the White House Coronavirus Task Force, said he believed the entire U.S. needed to have a nationwide stay-at-home order.
If you look at what's going on in this country, I just don't understand why we're not doing that. We really should be.
Then the president said he didn't believe that was necessary.
We have a thing called the Constitution, which I cherish, number one. Number two, those governors, I know every one of them, they're doing a great job. They're being very, very successful in what they're doing. And as you know, I want the governors to be running things. Now, in some cases, we'll supersede. But in this case, it's not.
You think they should? I'm not asking for
I think it
them to,
depends.
but
It depends on the individual state that you're talking about. But they're doing very well.
The problem here is that the average American person isn't getting a clear answer between high-sitting U.S. officials that are supposed to be working together to put out one cohesive message. That's not happening. Hopefully soon we can get answers for everyone that are understandable, coherent, and most of all, helpful. We'll be right back.
New York is the canary in the coal mine. What happens to New York is going to wind up happening in your city and in your community. We are going to fight every way we can to save every life that we can. We are all first responders. Your actions can either save or endanger a life. Job one has to be save lives. That has to be the priority.
This year, you can complete the census by calling or going online.
Or return your form by mail.
Make your family count!
It only takes 10 minutes to fill out the 2020 census online, over the phone, or by mail.
As the nation's doctor, I often get asked, what should I do if I think I might have coronavirus?
People who are sick should stay home. You don't go to an emergency room. You don't go to a clinic. get on the phone and you ask for advice and instructions from your physician.
We don't want you to go into the ER or the doctor's office without talking to them first, because you might spread coronavirus to someone else. Please visit coronavirus.gov for more information.
Businesses around the country have been forced to close due to the threat of the coronavirus if they're deemed not essential. Golf courses, though, may actually be exempt from that rule. Jack Hirsch reports.
Robert Kleckner's golf course in Linfield National is empty now because of the coronavirus pandemic.
I'm in total shutdown. So I went from having, one of the best quarters since 2001 to totally zero revenue.
He's not alone. Unlike in some other states, under Governor Tom Wolf's stay-at-home order, Pennsylvania golf courses can't be open. Linfield closed all operations on March 15th, including the golf course, 6 indoor simulators, food, and beverage. He says golf can be a safe way to escape in this difficult time.
Just for the mental side of it, just to get out and walk and get outside, and because there is a lot of pressure on everybody.
While PA's golf courses are closed, several neighboring states allow golf, including Ohio, where Penn State women's golf sophomore Sarah Willis keeps teeing it up every day.
I definitely feel a little guilty going to the golf courses right now because I don't think it's necessarily necessary.
Ohio went back and forth on allowing golf, but ultimately exempted courses as long as they enforce proper social distancing guidelines, like raising cups to avoid touching the hole, playing without rakes, and keeping clubhouses closed. Kleckner hopes PA courses can implement similar social distancing guidelines and is working with many PA golf associations to lobby Wolf.
We're preparing to open. We're not allowed to open yet, but when we do open, we're going to be ahead of it. So we have something we can show the state and show our customers what we're going to do.
In the meantime, some golfers are taking advantage of backyard ranges and hitting nets, including this reporter.
For the time being, this is about as close as anyone in Pennsylvania is going to get to a tee box. Reporting in Montgomery County, I'm Jack Hirsch for the Center County Report.
I certainly miss golfing. I do. I miss hanging with my friends. I miss all of it. But look, we're human. We weren't meant to be socially separated from so many people, both that we love and that we care about. Many of us are in our houses in quarantine, and that's leading to a lot of uncertainty, rightfully so. When are the new cases going to start going down? When can I go back out and hang with my friends? When can I see my grandparents who are alone in their house? I get it. There's a lot of uncertainty, but you've got to know this is for all of our own good. If you read the list of symptoms and you talk to people that have had or currently have the virus, you do not want it. The number of cases and deaths are big right now, but we can't let those numbers just be numbers. Every single one of them are a brother, a mom, a sister, or a dad to somebody else. The virus is affecting many more than the numbers indicate. This is serious, and I'm starting to see people, for the most part, are taking it seriously. The leadership in the country, well, that's yet to be seen. But regardless, with a combined human effort, we will get through this together. Just hang in there. Thanks for joining me tonight. Until next week, stay safe. Good night.